Good evening. Welcome, frauders. Glad to have you here tonight just to go over the Breaking the Chain guide, answer the questions that you all have, and to get us at a couple of common points, hear your concerns. If we don't have the answers, to go back out and get them, but really just drop a couple of highlights of the guide and then answer the questions you have. And if we don't have those answers, guess what? Chris and I are going to be spending the rest of the week with James R. Favor, with Lambda Chi, with Fidel, SAE doing our summer training. So it's very well timed for our Q&A webinar tonight, and just want to get it kicked off, but I'll allow Chris to say hi to everyone really quick.
Yeah, thanks everybody for being here. I see the attendee numbers still kind of creeping up as people are clicking the buttons and joining us. So I do appreciate you being here tonight. And I hope that you will share this information with other volunteers in your network, whether that's directly with the guys working in your own chapter or perhaps your province team, but also on social media. The information you've gathered from reviewing and or some of the questions here, the more we can get that chatter volunteer to volunteer will help, but I'm sure Greg will have some clarification about what things to come to the source for, and I'll leave that in his neighborhood. But one thing I would offer, we have both a chat function and a Q&A function here in the menu, and I would appreciate it. I'm going to be helping moderate questions. I'm going to jump off camera here shortly and let Greg do his thing. And then I'll come back and help moderate the questions. So if you have a question that you would like to submit for the Q&A part of the program, please do that in the Q&A section. I will be keeping an eye on the chat as well, but sometimes it's easier to miss something if it falls in there. So feel free to just say hi to each other and do the informal chat in the chat and official submission of questions, if you will. Using the Q&A button there in your menu. So with that, I will mute myself and jump off camera, and I'll return for the latter part of the program.
Thanks, Chris. Just as we were getting going here, Chris was telling me about the number of registrants and where everyone's coming from. We have a great cross-section of members here tonight from all across Teak Nation. Just fantastic to have everyone here, and I really do appreciate it. As we kick off, and as you're starting to think about some of the questions, I wanted to highlight a few things from the guide, which has already been updated. They sent out version 2 to us, I believe, a day or so ago. And Alex Baker, as I was driving to the office to do our Q&A webinar tonight, clicked it to go live on the guide page. So if you want an updated version, the latest updated version that we're always going to have is going to be on that guide page. So teak.org. Guides. I'm sure Alex is out there. Could probably put that in the chat for me for people that are looking for those guides. The insurance guide is up there as well. I get a bunch of questions about our insurance coverage. I'm always happy to answer them, but many of those can be answered right there in that guide as well, along with our whole library of other guides that are helpful to the resources that we have. So to get us started, I wanted to walk through just a few pieces of the guide to get us going. So we just had that functional understanding of some of the things to highlight. One of the email questions that we got was from Frater Dreising up in New Jersey, and asked a great question. He said, "Hey Greg, hey Chris, is there a 1 or 2 pager that I can just take to my first chapter meeting and get to the guys?" Unfortunately, there isn't, but that's one thing I'm going to ask for this week. And in doing so, he asked me for some highlights and some things that I would bring up to the guys. And I wanted to go through just those points here quickly as we get kicked off. And I'm going to go from the last piece, and then I'm going to start from back at the top. So this may be a little out of sync if you're looking at the guide, but I think it makes more sense chronologically. I want to start by the products and all of those companies that are listed at the end, and the things that are easy to come by now that we've been in a few months of the pandemic. Things that guys can get that are just even handy to have around any chapter house, or even their own house, or perhaps even your house. And it has to do with the cleaning, the thermometers, just masks, all that kind of simple thing. And I brought along basically my whole kit from home, things that I have, things that we use at the Roscoff house. And I want to just kind of share with you some of those pieces, which are really easy to get. The first thing are just a real simple basic box of nitrile gloves. And now these are 6mm ones. I prefer the 9mm ones. They're a little bit more robust. You can actually get some that have a little bit of grip on them. But in the guide, there's a how-to on how to utilize these gloves. Just full disclosure here, as a home brewer, you've got to pay close attention to a lot of this stuff. It's where I learned many of these practices. And I'm constantly wearing gloves when I'm touching food product, when I'm cleaning, when I'm just getting stuff done, because of the protection they have and just the safety to other people and to not spread any sort of disease or infection. So I prefer the 9. I got the 6 because that's all they had in stock. But I'll go through those pretty quickly and then be back out ordering. These little spray bottles, you can put bulk chemical in. Make sure you get the industrial sprayer with the right kind of plastic. Some of the pHs or the balance of the chemicals are just going to deteriorate the cheaper plastic bottles. I think I got this at Lowe's for a couple of bucks. Real simple, real easy to pick up. You can put chemicals in it, put it around the house, people can clean and spray. These disinfectant wipes, they're fantastic. We've got them all around the office, got them all in my house. Kills 99.9% of bacteria. They put a website inside the guide to check products to see how effective they are. So very, very important. One thing I want to point out that I bought by mistake one time was this here alcohol. And this is a 91%. And I wanted actually a little bit lower so I could increase the contact time. And as you go through the guide, then they talk about cleaning, it really hones in on contact time, right? So for example, I use a sanitizer, a foaming sanitizer, and it requires 60 seconds of contact time for that to be actually sanitized. So be careful, read those labels, understand, educate your guys. To me, we can go out and get all these products. This stuff is great. But if you don't know how to use it or you're using it incorrectly, it just doesn't get the job done for what we want. Other things, basic, simple safety glasses. I also have a pair that I've got ordered that go over my glasses, but again, you want them to make sure they come around the eye. So when you're cleaning, you don't want anything to splash, get into the eye. So make sure they come around the eye. Other really simple things to get around the house, hand sanitizer. We're looking at 60% or better in terms of the alcohol. You got to be careful with the foaming sanitizers, right? So there are many, many products out there that are child safe, child approved, child this, and they're foaming, and they're fantastic for killing bacteria, but they don't necessarily kill virus. They don't necessarily kill all bacteria either. They're super effective, but there's not that alcohol component to them. And they're great, but they're not as effective as some of the other products. So read the labels, understand the labels. Masks, I got this mask in a 2-pack at Target for $4. I know a lot of people are selling them online and whatever kind of facial coverings, but they're really inexpensive to get. And like I said, I got these at Target. It was a 2-pack of these. They're extra large. So I know I have a little bit bigger head, so this actually fits. So take a look at that. Make sure you're getting the right stuff. There's also disposable masks. I didn't have any with me today, but you can buy those by the box too. Make sure you have some of that extra stuff on hand. The other thing I want to highlight, and I was showing this to Chris before we get started, is we bought a infrared contactless thermometer. And I got this with the coating on it because it made it super easy for my children to use. My 5-year-old has used this. It's not that complicated. You calibrate by just turning it on right there, and then boom, right in front of the forehead. One beep. I'm at 98.9. A little hot under the lights here, but it shows me that I'm green, show me that I'm yellow. The big part about this is you want to check on the back to look for all of the certifications. This one carries the level 2 certification on it. So it's made by Easy Things. I picked this thing up on Amazon for probably $80. Came to my house in about a week. We've been using it ever since, and it's super effective. So one of those big things that I want to highlight are these products and things. So if you have questions on anything that I showed or anything that they've listed, I'm fairly well versed, not an expert by any means, but fairly well versed in some of those. So feel free to ask. those questions. I'm happy to answer them to the best of my ability. One of the things that I don't have that some of you may want to consider is a disinfectant mat, which you put some chemical in, and then you step on it and it disinfects shoes. So that's something to consider. It's probably going to be a little bit more of a luxury. Also, again, you got to read the instructions on it and make sure you're utilizing it effectively and with the right concentration of everything. So products, super important. Feel free to ask any questions on those. I'm happy to do so. Now, I know we want to get to the questions and get to everything here, but I want to just highlight a couple of other things in the guide that everyone should be paying attention to. And first is the terminology right up the front and the CDC messaging. It's laced through the whole guide, and it really focuses on following the guidance that you have locally, okay? So for example, I'm standing in Marion County, Indianapolis. I have to wear a mask when I go to things. There are certain requirements for the number of people that can attend events, certain requirements for just business going on. If I go where I live, which is in Hendricks County, one county over, I don't have to wear a mask if I go into places. It's like two different worlds between Hendricks County and Marion County where they stop you at the door. Whereas where I'm living, I go to the grocery store, a lot of people aren't even, wearing masks. And I don't want to make this political. I don't want to get into politics of masks, whether they work or not. It's all about following the law, following the local guidance. So learn that terminology, know that terminology, spend a little bit extra time there. That huge list of recommendations. There's so many things in there, a lot of good stuff, a lot of stuff that might be, seem a little bit excessive, but it's a great idea for some groups. The signage around the house. Signage is always a good thing. Vet that signage out, make sure it's what you want to be saying to people, but have it posted, especially if you're going to do a check-in zone. Hand sanitizer, placing that out. Like I said, these things are easy to come by now. There are a lot of companies making them, big ones. Just get the right sizes for what you need and place it around the house. And people are kind of in second nature with using it stuff now, so they'll come to use it. They talked about utilizing the thermometer. Like I said, this one, $80. It's some of the highest spec that's out there. I looked it up for the guidelines, and yeah, it's good stuff. Sign-in sheets, that was other thing that's in the recommendations. Really be working with your guys if you're going to do sign-in sheets, especially at events. We want those to be accurate. We want those to be just the basic information. We don't need to be recording people's vitals. So just be aware of that guidance in there. They talked about masks. They talked about the number of people, making sure that there's different parts of the house that, hey, if you're going to have this many people, cap it off at whatever maximum can be in that for safe physical distancing, especially in those common places. There's a bunch of great stuff in there about events and how to run events, how to have that checkpoint when you walk in, to use a third-party vendor, and to understand the agreements when people are coming, whether it's to a house or to an event, whether that's a hold harmless agreement, whether that's some sort of just awareness agreement, or the contract that you have with any vendors. There's a bunch in there about serving food. There's a bunch in there about you doing a buffet style versus individual. Obviously, individual is going to be at a higher safety level, so you want to stick to that. But read those contracts, especially if you have someone coming in. What protocols are they taking to protect themselves? So they're going to be motivated by getting that paycheck, but you got to make sure that the safety pieces are in there. There's great stuff in there, how to inspect your house and open it up properly, deep cleaning in between semesters, things we probably should be doing anyways. There's a lot of great information in there about those. And then to focus on cleaning, how many guys are really taught how to clean? When I was reading through this, I was putting myself in the mind of an 18-year-old, 20-year-old. How many people are really taught how to clean from, the high to low, the less dirty to more dirty? You have to clean before you disinfect, right? You can't just disinfect something that's dirty. It stays dirty. So you've got to clean first. So those basic principles and just things around air quality, that type of stuff, you have to apply the right tools to your situation there. And then lastly, but almost maybe even most importantly, are the wellness pieces in there about how to keep yourself mentally healthy. Just the awareness checks on people. I know some folks are considering using apps. Check the settings and how they monitor people, and just because it's on their phone. You don't want to be necessarily tracking them everywhere they go. There's some privacy things with that, but there's starting to be better technology and things to track this stuff out there. But health and wellness, super, super important, especially if you have an isolation room with someone in there for 14 days. You really want to focus on their mental health and how they're doing, not only physically, but mentally as well. The isolation from humans, man is a social being. We know better than anyone that isolation isn't always the best thing. So to kick us off, I just wanted to do, 10 minutes, 15 minutes here of just some very simple stuff that I thought were things to go back and take a look at, walk you through the guide just very briefly, but then really just answer your questions. So I'm going to ask Chris to come back and answer or ask a question or two and get me kicked off here on the Q&A part. So, Chris.
Glad to be back. Happy to help. I do have some questions already. Some guys submitted on email earlier today, and we've got a couple in the Q&A section already, so I will help moderate that. But if you have other questions from what Greg shared or something you were kind of waiting on that he didn't touch on yet, or anything else that even comes up from the live Q&A now, please hit that in the Q&A. And I see someone else just popped that, so I'll get to that as well. One quick question, well, two I'll throw at you kind of quick, Greg. There was a question about teak face masks and whether we were going to have such things. And then there was also a question from Steve Cassidy at Purdue, specifically asking if there are other or extra considerations for alumni events beyond what's in this guide. So I thought you could start with those two.
Yeah, thank you. Excellent way to kick us off here. I appreciate it. Keep those questions coming as they come to you, and we'll keep on rolling. So on the teak masks thing, I know Alex Baker has been working with a few companies through the proper licensing rights. I'm not sure exactly where we are in that process. I just do know that it is in the process. Alex, if you're out there, if you could hit the chat and give an update, that would be fantastic. But I know that that's in the process so that they get the correct logos, the correct sizing. We don't want, some triangles that are, half the length and the wrong length on the third side. So that's all in the works. So I know that's, we don't want to profit off the pandemic. That's not the intention of selling these. It's to make sure that our guys have something that they're willing to wear. And if they can dress up something better than, just this simple red mask, then great. As far as the alumni events go, there really isn't going to be much difference in terms of guidance, whether that's from our regular risk management guidelines or to the COVID type guidance and the manuals and the things that are out there. You're always going to want to check the location and what the CDC and the local government, even the campus, has to say about it, what those rules, those regulations, those restrictions are. You're going to want to take a look at what's in your contract and go through those details and make sure that you can meet those obligations in the contract if they're requiring you to bring stuff. But in reality, we want you to abide by the same set of rules. We don't want the collegiates to have to adhere to some standard, the alumni, well, we're not active, so we don't have to adhere to that. We want to stay consistent in both the active collegiate members and the alumni, and any networking, any events, any happy hours, that kind of thing. We want to apply basically essentially nothing different in both of those guidelines. So stay on the CDC and the local level and what they're suggesting, and you shouldn't have any problems with either alumni and or collegiate events.
Thanks, Greg. And from Maine, Will Liberty's on with us and was asking about the additional guides that Favor was referring to, the SOPs,
Yep.
and he was asking where those are coming from. I don't know if it's as clear that they are additional Favor pieces that people can expect.
Yeah. I believe that they're going to update those in the next version of the guide. So check on teak.org guides for the most updated version. And I believe as those get vetted out, they're dropping in about once a week here with updates and things. So I imagine we'll be trained on those this week and then be able to post those. And if anyone has any questions, feel free to direct that back to myself or, whoever you can get a hold of, and we'll find the right answer. So I know there's, I believe, 9 of them. I saw the first draft of them. And I believe that they were going to try and include them as an appendix or a part of the guide. And I'm not sure if they've completely done that. I only made sure I had the guide downloaded, went through it again. But we have all those, and if Favor gives us the green light to post them, I'll make sure Alex Baker has them and they get posted.
Great. Many of the other questions are in the space of the waiver forms, and yeah, you and I talked about some of this before. There's a peppering of kind of pieces here, so I'll just kind of keep hitting you with a set of various waiver pieces. Hopefully, I'll protect you from they just overlapping on themselves. Steve Schulte asks about whether whether that waiver form can be incorporated into an event sign-up sheet. And is that, or does it need to be something explicitly separate?
So you're going to have an event and you want people to register like through Eventbrite or some third-party registration system, or maybe you have one in-house, I don't know. Yes, you can incorporate all the warnings and the event type stuff, and prior to attending the event, you need to agree to these terms. That shouldn't be a problem in terms of getting out your warnings, getting out your hold harmless type agreements. But just make sure that when they check in that you have the most up-to-date on file and that they did sign it. And if they're going to do it electronically, utilize the electronic protections of like logging IP. I read and understand this. I'm in sound mind type language. When you do that, I'm sure there's a bunch of boilerplate out there with whatever software or company you're using. But make sure you put in the specifics if the venue has certain specifics. But yeah, I don't see any problems with having them sign before and letting them know and verifying that, yep, and you did sign your waiver, so you're welcome to come in through the checkpoint.
And Frater Beckling had offered this one on email before we got started. Knowing that much of the waiver language is about the visitors to the house. Yep. So what about guys that are residents and are living in the house? What, if anything, do they need to sign? And is there anything differently appropriate for our own members who aren't just the random visitors, but are the frequent flyers, so to speak?
Yeah, the guys that are coming and going to class, coming and going to work, coming and going to different events. I think there's two ways to approach this. One, you likely have all the contracts for the year signed. So whatever's in that lease agreement is in that lease agreement. It's more or less banked in. So you've got an option to, one, get everyone to agree to a new lease agreement and lay that out. But more commonly, and probably the easiest methodology for doing this, is checking your lease agreement and making sure you have provisions for chapter rules and house rules, which by signing the lease, they agree to those house rules. And then you can have an updated 2020 version of house rules, which include you agree to abide by all the CDC guidelines, you agree to abide by the local level guidance and laws and policies, things that we pretty much already have in place anyways, but you just make it that much more clear. So if you don't have that type of language and you just use a simple boilerplate lease in your jurisdiction, in your state, or in Canada, however that works up there with the Canadians just being a little bit different than the Americans. Also want to keep those guys just as safe, but work that into your contract language for the following year. And then you'd want to get all those residents to sign and agree to an addendum to that contract and note it. I suggest working with a local attorney. They're going to understand what's legal in order for you to do that or not. We actually talked about this with one of the colonies that's coming back out of Westchester. They had asked about putting in cameras. And what does that mean? Well, if you didn't have cameras in at the start of a contract, putting it in halfway through, you got to get the residents to agree. So there's really not much difference when it comes to applying these things. You just got to be really smart and speak to some local guidance on how to properly go about that, about altering a lease, given the pandemic. There might even be some language that you don't know about or I wouldn't know about because it's in a state that I'm not doing most of my business. So, yeah.
Yep. And here's another one of the early ones we got from Mark down in Georgia. in terms of, like you talked about, you already shared examples of many of the products, and obviously the guide has a whole range of recommendations.
Oh, yeah.
So his question is, if we're unable financially to fill all of these gaps, cover all of the recommendations in the policy, what implications might that have for our coverages?
Yeah, it's a great question. All of these are great questions. I know I'm going to get hit for that, for just saying it, but I was really looking forward to this question as well, because one of the top 5 things, if you will, that is never going to be insurable is going to be pandemic, and that's just the big unknown right now, right? There's no case law on this. There's no real way to figure out what's going on applying 2020 law. So when it comes to directly to the pandemic, there's going to be coverage exclusions. Now, when it comes to whether or not you follow the guidance, these are recommendations. So this is what we recommend you do. If you got to go bankrupt to do it, that's probably not a good idea. You want to be in communication with your school and other suppliers to make sure that you're doing on par with what others are doing in that area. What does your traffic look like? Are you having 60 guys in the house? It's a completely different game than if you've got 10 or even less, maybe 5 guys. We've got some chapters that have smaller facilities. So I think you have to match up what the expectations are versus what's actually possible. So when it comes back to the coverage question, you got to be doing the good faith effort, the reasonable man standard, putting it forth that you're abiding by the local laws, you're abiding by the guidance to the best of your ability. And the recommendations in the guide are to that top, big level. If you can't afford to get everything, you got to figure out what are the priorities. What are the priorities? What can we do to establish a good, healthy, safe environment? And what's our protocol? For example, I think Tom Geary from down at the Southern Indiana, IU Southeast rather, sent us a phased-in plan of how they're going to go back to chapter meetings, how they're going to go back to events, how they're going to go back to doing regular business. Well, they can then budget out and see where things are going based on those phases. So they're going from a more strict to a more lenient, and ultimately whatever back to normal business is going to look like in the future. So I think if you phase that plan out, you're going to understand what kind of equipment, what kind of cleaning, what kind of sanitizer you're going through, and then you can go out and apply that appropriately. So where I don't want to get anyone confused going back to coverage is, are we covered as a board? Are we covered as a housing corporation should the chapter do something? And I see this, by the way, this hasn't been tested, but I see this very similar as if the guys in the chapter are not following the alcohol guidelines. They're not following the protocols that are put forth by the school or even by you as a housing corporation. You still have certain levels of protection because the claim wouldn't necessarily come from the pandemic. So if someone decided to take the hand sanitizer and realizes that it's flammable and starts playing with fire, you didn't endorse that. You didn't put that out there. So you put the hand sanitizer out there, but not to go burning it. So you do still have some of those levels of protection against liability that stem from particular claims. So I don't want to confuse anyone on what coverage is. And if I am, please put it in the Q&A to clarify this. But the coverage is still going to be there for the liability purposes and things along those lines. It's just that if it's directly pandemic related and you have a pandemic claim, it's really uncharted territory of whether or not that falls under the exclusion, and most likely does. So Mark, if I need to answer that better, find a time when we can chat here in the next week or so, and I can go through a little bit more in depth of what you may need to provide, what perhaps the school may provide students, and to help walk through that a little bit more.
The other part of Mark's question was, again, based on what we can or cannot do, are they recommending alternative living arrangements for members? And if so, then would that again, affect our coverages if they're living elsewhere or whatever else that might turn into, I guess.
Yeah, what's going to affect your coverage? Are you talking about your property insurance, or are you talking about your liability insurance? Because those are going to be two different beasts. If you're going to have an extended period of time where there's no one in the chapter house, right now they're kind of grouping this in as some version of pandemic and not changing any requirements, not requiring unoccupied house insurance type things. So yes, there are reasons where we'd have to go to that, but only that's going to be for an extended period past the start of fall is basically what I've been told. Now, if your occupancy goes from 60 people down to 30 people, does that change the coverages? Are you starting to close certain things off, that kind of thing? Yeah, absolutely. But I think what you got to do is go back when you purchase your yearly policy, is let them know, hey, these are the updates that we've done now. Here's what we're looking to do in the future. What does this mean for potential policy implications for our house going forward? Because they're insuring that property if it's a full functional facility and you've maxed out the people. So you got to be pretty frank and forthright with the insurance company, and then there might be some adjustments in their algorithms as to what is and what isn't going to be charged for coverages. So I think you got to be aware of the amount of people that you have, yes, the wear and tear in the house, that kind of stuff, and the protections that you made. You lay out a good case, there might be reasons for you to lower that premium.
Yep. Thanks for that. Mike Vogel out at Drake has a couple questions in here, and I appreciate that, Mike. I know you're hitting a couple of the really important points, but he responded, I think, directly to your comment about Fraudagiri's plan that he shared on Facebook, and that's what Vogel's asking about is how and where are we sharing those, or where should we be sharing those in this information age, so that folks across Teak Nation have access and examples rather than everybody at the same time trying to recreate the wheel. So there have been questions about sample waiver forms. There have been questions around lease language for leases. And I know in many cases, especially peer-to-peer, a lot of that happens in the Facebook groups, and that's a big part of why we make those groups available and encourage people to use them for the peer-to-peer stuff. But from your perspective too, Greg, and I know Baker, you're out there in the chat, other thoughts on how or where we should be doing that, or where we are doing that, and what documentation do we expect we may be able to share some samples or some templates relative to this? Particularly what's come up is waivers, leases, and house rules.
So there is, on Favor's website, there is a standard lease that they have for housing corporations. And so that information is housed on their website. So if you're looking for that standard lease, they should have it underneath their resources. I know their website's going to be going through an update here soon, but that should stay right there. As far as the hold harmless waiver agreements, so Favor's provided us with 4 of them, and I'm still not clear on exactly how they want us to utilize them. My goal was to ask that question during training this week. When I get better clarification, these were written by Mike, and Mike is the attorney for James R. Favor. He's their in-house counsel. He's a Lambda Chi. He understands fraternity. These are written by a fraternity man for fraternity men. When I get that clarification on how to best to use them, we had a training about 2 weeks ago with Favor, and I didn't get the answer that I wanted. And my hope is, now that they've had some more time to digest this guide, that I'm going to have a better grasp of how to utilize these. And there are 4 of them. There's one for guests that are coming and going. There's one for alumni. There's just one for general use of contractors and people coming and going. And then there's the special event one, I believe. So when I get a better clarification of those, I'll make sure that we update that in some sort of guide. I'm sure Baker could whip up a web page of COVID housing type resources that would include that, along with the other SOPs that you guys had asked for earlier. It's all so new, and that's where we're really coming from. Is we're looking from the guidance of the people that spent the money to go get the guidance so that we can get it back out to you. But we want to be able to understand it the best we can. It's one of the reasons why I wanted to do this webinar today, is that if you all have questions that I don't have the answer to, I can go get them this week and get back to you guys. So Mike, if there's something that I'm not hitting on, I'll definitely please reach out to me so we can set up a time to talk. But that said, the protocols and the things, if you've got something that's templated out for your area, feel free to send that to us, and then we'll pass that by the insurance folks and say, hey, we're thinking about putting these resources up there. The first one that I got was Thomas's. He asked me for my feedback. And to me, I was like, you got a lot of 1.5, 2.5 type scenarios in there of what constitutes an event, what constitutes the number of people. So to me, the training on the job aid is as, if not more important than the actual job aid itself, because that's going to be a living, breathing document. And it's going to be different in every single community, jurisdiction, wherever you're at. The guidance in Texas right now is completely different than the guidance for the colony in Wyoming, which is completely different for our guys in California, which is completely different for our guys up in the Northeast. And if you go to New York or Connecticut right now, you've got to quarantine for 14 days. There's a note from University of Florida that they plan to be in-person classes, but Florida has blown cases out of the water. So where that settles, I'm not quite sure. You got to adapt that plan. So I'm not sure if there's an ideal template for everyone to use, but I'm willing to if you've got some ideas, or if you want us to take a look at it, and I pass that along to some other folks to have that resource and how to phase back in. What it has to do is it really has to mirror what the local guidance and the local laws are telling you. That's going to be my best advice and my best guidance on that, is to take a look at what the school is doing to phase in and what the school is going to consider for protocol. For example, if you do own a house and you've got X number of rooms and you go as far as having that isolation room, what happens if another guy gets it? What happens if majority of guys get it? So you want to focus on what do those scenarios look like and play them out. Are you going to be sending people home, back to their hometown, and what sort of implications does that have? So you want to play out these scenarios as a housing corp, just to make sure you have the proper guidance for your guys, and training them on that guidance, I think, is the key part in to say, this is what we're doing. Here's why, here's whatever. If they've got questions, answer them. But all this stuff is so brand new. Even the thought of having in a phasing is a brand new thing. So I'm happy to take those and pass them by the folks that, look at contracts and look at that stuff all the time, and then get a resource going. It's what you guys are asking for, so we'll find a way to do it.
And another piece I want to knock down for Frater Vogel, for houses where they're in single occupancy mode, whether that was already what they're doing or they've already made the decision to change to that.
Yep.
What is the need for additional isolation rooms, or what considerations would need to be taken if there is still a need for isolation rooms if they're already in single only rooms?
Yeah, absolutely. Great question. I think moving to that is, if you can do it and afford to do it, that's going to be one of the better case scenarios. If you were able to distance the rooms, that would, again, be another level of protection. So no one's within even walking by the room and perhaps picking something up. There's just general things that you can and can't do about an airborne disease. It's just the reality that we're in. I think if you've got people that are already in single rooms, what's your protocol for cleaning that room? What's your protocol for those bed sheets, those linens, all that guidance that's in the document? If you have that down and they're in their own room, I think you've probably taken the right step, unless you want to isolate them away from other people. perhaps they're the guy at the first room at the end of the hallway, and everyone's going to have to walk past the individual who has it. That would be probably the crap situation here. If you did have an individual and you might want to isolate them in a different place, but you also don't want to be bouncing people's rooms around. So it's got to be practical. I think if they're already in their own rooms, what is your protocol to then service that individual in the room? How are you getting them food? How are you getting them the sustenance and the things that they need? How are we keeping it clean? How are we coming and going? What other protections can we put in place so when people are going by? I would focus on the cleanliness, that wellness characteristics around those. If you've already got them in singles, there's less of a need to have an isolation room. So really it's going to be really dependent on your occupancy and I think where they're coming and going from. And if you can truly isolate that person there and everyone else is feeling good and safe about it, and the protocol is in place to take care of that individual, make sure they're fed and all the other pieces that go along with it, I think you're probably in a really good spot. And I don't think you got to go much further unless you're actually able to isolate away from all the common areas and the comings and goings.
In addition to the traffic piece that you emphasized in there, are there any other special considerations in terms of bathrooms relative to this isolation room scenario?
Yeah, absolutely. I think you've got to have a protocol for how that person comes and goes to the bathroom, what sort of protection equipment that they're wearing, what's the protocol for them to clean the bathroom once things are done. So absolutely, bathrooms, kitchens, if they've got to go to the doctor, how they're getting there, making sure you're having those kinds of conversations about just the logistics and comings and going. But yeah, you're going to probably have group showers, group bathrooms with multiple showers and multiple sinks, that kind of thing. Whatever that protocol needs to be in terms of cleanliness, I think we got to up that game regardless, because I've seen some pretty nasty houses out there. You clean it like Nationals is coming, probably could be a good tagline. But yeah, I think if you're following the guidance to the best of your ability and you're not able to give a private bathroom, then yeah, you're going to have a protocol for bathroom.
We've got about 3 other questions, so we can keep working on these. Just want to put out another call. If anybody has additional questions that you're wanting to add into the queue, please do so. John Gorski asks, well, and like you said, there are a lot of good questions that have already been happening. But this specifically, he's asking, in a sense, aren't we under the control of the college or the university and their policies and procedures, and where, we live in that space anyways, but how is this similar to what it always has been, and how is this perhaps now different in terms of some of these issues?
Yeah, wow. I will tell you, this is the biggest concern that I have going forward is what are our universities going to say? What are they going to do? How are they setting students up for success? And we already know that enforcement between the residence halls and what happens in the fraternity house is not always congruent. So we've got to play this dead straight as we can and ask tough questions of them, getting understanding of what it is that their expectations are and how things have changed. We've got a school in Chicago at Loyola that basically, according to the guys, they're not able to do any events or anything on campus for the whole school year. So fall and spring. So yeah, the university is going to dictate a lot of our policy, and it's in the Black Book to follow university orders and rules. It's in the guidelines, the risk management guidelines already. So that stuff is already out there. And absolutely, we've got to be really clear with our universities on what their expectations are, what their rule changes are, and what guidance they have, so we can properly educate our guys, give them the right guidance, and then set ourselves up for success. So each school, again, is going to be a little bit different, private versus public, different parts of the country. They're going to apply it a little bit differently. So you got to go back down to the local level and start asking those questions. But yeah, we absolutely are going to be needing to abide by the university rules, because they're taking their property and elevating it to whatever level that they see necessary, and they're applying the local laws as well. So good open dialogue about that. I already know some universities are having trainings, having some webinar Q&A stuff like this already. So if they're being offered, seek them out, ask your collegiate members about them, and do your best to get informed and figure out who you can talk to.
And keeping it in that very local sense, another question about house rules, and specifically, this is from a board member, John, who's asking about wearing of masks in the house, and where does that policy come from? Do we have any recommendations on or tips on how to get the students to take ownership and pass such a policy, or is it appropriate for the board to institute such a policy? Where does that stand in terms of the house rules level of this?
Yeah, you put this thing on, your glasses fog up in 2 seconds, and you don't want to have a guy that trips on the stairs because he can't see where he's going, right? I think that there's no super good answer for this. You want the guys, obviously, to drive a lot of their own self-policing type activities in the house. Like, you say something, you do something about it. Not that you've got to go and police them. Actually, I would suggest against that. I would take the things that come in and handle them as they come in, and proactively educate on why you should do these things. I think having a very frank conversation with the men in your house and the men in your chapter about where to draw that line and what is reasonable. And if you want it at a higher standard, how to push them to that higher standard of why we need to do this, and here's what we're going to do. And if you can get their buy-in and have them just, okay, good, this is what we're doing, this is what we're going, then you're going to be in obviously a much more amicable situation than if you've got to, mandate it on down. And I think as a property owner, you've got to find out what other property owners are doing, what other businesses are doing, and find that sweet spot of what you can press on. Because, so for example, I went to the University of Wisconsin-Milwaukee, and I lived in an apartment complex that was basically all students. Am I required in the hallways to wherever I go with the other, 60, 70 people that were living there? That's going to be up to that landlord and, the safety and protection of those other residents. So I think it's super important to, one, communicate, and then understand what the reasonable expectations are. Over in Marion County, like I said, you got to wear this to go into a business. So I think it's pretty simple to say, common spaces of the house coming and going, put these on. And maybe if we're in a common area or if it's a meal space area, that could maybe be our mask-free zone for eating, not for congregating, not for whatever. This is obviously a pretty extreme scenario. In their home, you would want them to feel safe and welcome and well. So probably could back off some of those protocols, especially when they're in their rooms or when they're limiting the number of people and they're socially, physically distanced in those common spaces. So, much like you would go hang out with your neighbors and go to a barbecue, maybe there's, instead of 5 families, there's only 3 families, and we're separating people out, that kind of thing, and we can draw the line there for masks. So that, to me, I think is the biggest thing. One, how much space do you have? Do you have a lot of common space where people are going to be coming and going? And then really asking them, where they feel comfortable, and then starting it off there and getting them to the level of where you need to be, especially with, temperature checks, hand sanitizer, that kind of stuff, things that they're already going to be used to because they've been doing it for a couple of months now. But yeah, I would say in the common areas, you might want to consider a mask policy, especially if there's a lot of comings and goings, and making sure you can keep it clean and then disinfect. Did I hit all of that there, Chris, or is there something that you want me to go back on?
I think so. I believe so. And then there's another layer to this that I'll add on in a related question. John, if there's something else here or anybody else, please just drop it into the Q&A. Do we expect, Greg, that there is going to be any more explicit policy level expectations from headquarters about masks or anything more specific kind of in the house other than the guidance? And would there be the other specific piece of this that was asked? Would Teak is Teak thinking about any kind of incentivizing for chapters to put policies in place? And are we going to do anything on that incentive side?
Oh, I love incentives. So if you got ideas on incentives, send them our way. I know that money talks. So I'm not sure. We get our insurance billed, and then the risk fee is part of that. That's done in December. We have that paid in December. So there's a bunch of things that are going to go into this year's negotiation about the level that we're taking it, the level that the Phi Delts, the Lambda Chi's. So we want to stay, best in class, and then see if we can, push that up, and it'll help with our rates, of course. But to me, if you've got some ideas for incentives for guys, send them our way. And then the other piece you're asking there is if the international fraternity is going to have a policy on this. So we kind of already do, and it just depends on how much you want to, get your lawyering glasses on and lawyer this one. But we require everyone to abide by the local laws, of the state, the city, the county, whatever municipality it is, whatever that law is, we require people to follow that. So if your requirements are already at that standard, the only clarification we could have is some basic, simple language. Because we have however many chapters in however many states, because we have many different chapters in different municipalities, our policy has to be pretty generic to be encompassing. So when everyone complains about, well, everything's hazing. Well, the hazing policy is written to be encompassing and stay ahead of the game. So to me, if we're going to have a policy, and I know it's been discussed a little bit between us and Favor, and then maybe bouncing some language off. We have a risk committee call coming up in a little bit. Really is going to be that you follow the guidelines and you follow the local law that are there for you locally. And that's our expectation. So from the international fraternity, our expectation is that you're going to understand, you're going to put yourself, you're going to educate yourself in the best position to do what you can do locally. And that would be our policy. Now, if we're able to have events again, like right now, Leadership Academy, unfortunately, is not going to take place. But when we get to things like RLCs, yeah, we're going to have international ways to go about this based on where we're at. Based on whether it's Atlanta or whether it's New York, we're going to have certain levels of policies. And if it were right now to do an RLC in New York, we couldn't comply because I believe there's that 14-day quarantine there. You can't have an event if there's a 14-day quarantine. So we're really keeping our eye on what those programs and what those things are when there's something done with the international fraternity. But you locally, it's all about you understanding what the expectations are locally. So if guys want to push back, it's already in the guidelines. It's already in their membership agreements that they're going to follow their policies so we can utilize that. But I do think that there's a level here with this pandemic that we could maybe go that step further. It's not necessarily for me to decide. It's up to policymakers at the Grand Council level. But I do think that is a good thing to consider.
And with that too, I know you jumped into lawyerly mode. So you were talking municipal law, county, state law. I assume, and if I can kind of reinforce this from some of your early responses as well, you're also saying that our expectation is to abide by the campus policies as well as
absolutely.
The legal of all the layers, right?
Yeah, we have a handful of groups that are not recognized by the university. So from a group perspective, might not mean a whole hell of a lot, but from an individual perspective, it might mean quite a bit. So we do have some institutions where they don't recognize fraternity, or through various ways, another talk for another time. We're not actually a recognized organization there. It's still going to be important that the students are following campus policy, because if your guys get expelled or suspended or told to go home, it's not going to do you any good.
Yep. So I'll share one tip that came up here in the Q&A, give Greg a chance to actually catch his breath, take a moment, catch a drink if he needs some of his water. But John Gorski, full credit to Frater Gorski for this, for the fogging issue related back to Greg's earlier comment.
Yep.
An old surgeon's trick is to wash your glasses with dish soap, rinse them, and let them air dry. He says, trust him, it works. So I'll take that as a part-time glasses wearer. I wasn't aware of that, and I'll definitely put it to use. So I appreciate that, John.
Absolutely. And I'm going to be doing that tonight.
yeah, I'll definitely give that a shot. Anything that can help. And John dropped another question in here about, headquarters and favor. Perhaps it would help to have a handout of these policies as a handout to provide to the schools to show our aggressive approach, our responsiveness. Is it appropriate for us to be sharing these favor materials? What are the expectations there? What else
absolutely.
could we do in that space?
Yeah, I think the more transparent you are, the more trust you're going to build. And if you're going in, if you've got a Lambda Chi, an SAE, a ZBT, a Triangle, Sigma Chi, if you go to a campus where you've already got one of these other groups, they're getting the same guidance. They're getting the same level of back and forth here that you are, along with a couple other things. I know Lambda Chi sent a letter out about some policy type stuff, and they were able to let us see a little bit behind the curtain of what they're doing. So we may eventually do something along those lines too. But I think if you go in and say, hey, we're working through this document, we're gonna apply it in these ways. How do we stay in line with what you've got going on? That's a savvy move. The more hands you go in and shake, obviously after you sanitize, maybe you just elbow bump, or even virtually shake, the way better off you're gonna be in this, because it's gonna engage in dialogue. And it's gonna be like, hey, look, this is what I've got. These are the things that I'm coming with. Here are some of my solutions. How do I apply them to the policies, procedures, the requirements, the expectations that you have? And it's going to set you up for a heck of a lot more success when you're going in there prepared and having that discussion and say, hey, can you help me just walk through how we would apply these here and come up with a really good plan? Again, we kick this thing off with, what are my opening meeting chapter talking points? I think some of the job aid type stuff, it exists, like how to wash hands, how to clean, those kinds of things. I think you can find those out there, post that signage in your house, no problem. But when it comes back to the fraternity specific stuff, that I think I'm gonna go back to favor for. They're supposed to be coming out with some social media type things, but I think going back to them and saying, hey, what other job aid type stuff can we get from this company that you invested all this money in, that they produce professionally, that we can share? So Chris, let's make sure we write that down and go ask him for those things. I think it's a fantastic, quick help guides that guys can use. That you can laminate, get nice and clean, and post around the house. And it's a great suggestion, and one thing I'll definitely have to be asking about.
Yep, great. Kevin McCarthy asks, and Frater Nelson, please know I'm holding your question for last for our big finish. So I appreciate your patience. I know you tossed that question in very early, but I thought it was a good place for us to kind of wrap this thing. But Kevin asked about the need for creating any potential additional rules, special rules, if we know we have immunocompromised members in the chapter. Is that something we need to do? How do we do that?
Rules are one thing, protocols are another, procedure is another, standard operating procedure is another, and how we apply that, I think, is going to be a better path. So if you have certain rules, and I'm coming at this from again, throwing on my lawyering glasses, if I've got certain rules or certain policy that's set in stone, if I deviate from that, I'm opening myself up to some potential, hey, you didn't even follow your own, right? So it's kind of like if you have the legal standard, then you put a higher standard on your members. If you're not following that higher standard, you're the one who asked for this, so why didn't you follow it? I think it's the same thing. I think you need a standard operating procedure if you have someone that's immunocompromised, if you have someone that gets infected, if you have someone you've been around someone who's got the disease, they've got a confirmed positive test, and oh, wow, I was actually just grabbing coffee with that guy, and okay, wow. Different protocol for that person to isolate till they get their test results back. I think going through those and saying, this is what works for us, right? Some of you don't have chapter houses. Well, what does that protocol look like in coming to events or attending things? Can we set up a virtual way for that person to attend while they're getting their test results back? So I think that's the way to go. This is our protocol, our procedure. This is our guidance on it versus hard and steadfast policy rules. And the procedure stuff is much easier to update and then to put in the language of the best of our ability. But yeah, you don't want to bake yourself into these are the hard, fast rules, because then you got to do something with enforcement. But here's our protocol, our standard operating procedure. Oh, you deviated. Okay, well, here's why we deviated. And that's why the guide is listed with those SOPs, and that's why these are our recommendations.
And here's another one from Frater Gorski, jumping ahead and his planning horizon. I really appreciate this. His question is basically the back end of this, right? If we establish new protocols, new guidelines,
yeah,
are we married to these for time, eternity at this point? How do we unwind those? Like, how do you, as a matter of policy, undo protocols?
Yeah, I just think it depends on what are if it's a best, this lovely word, this best practice, right? If it is a best practice and you put it in, keep it. That's a great thing, right? Especially when it comes to getting things clean and keeping healthy environments and wellness checks on brothers and peer-to-peer engagement on brothers. That's going to help things, all sorts of wellness, mental wellness, physical health. Some of that stuff I think we're going to want to keep. It's the only positive out of the situation that we're in. And I think as far as the stuff that, the copious amounts of hand sanitizer, the copious amounts of gloves, the temperature checks, I think we got to stay in tune with the guidance from the professionals, from the doctors, from what the laws are. And once they start rolling that back, we can start to lower our need and start to lower our protocol and procedure on those. There are places right now where some campuses have asked students to self-quarantine for 14 days coming to school. The students laughed at that. So they balked at it, like, it ain't happening. This is my last 14 days of freedom before I show up to school. I'm getting my use out of it. So you got to have that conversation with your guys to know when to pull back and when to keep firm. And you don't want them to get lazy. You want to stay on top of it. But to me, one of the first things that's probably going to not be as necessary is the temperature checks, that kind of thing. Do I know that for a fact? No, I don't. But if we put that protocol in place now, it might be we get to some better science, we get to some better restriction lifting scenarios. We're not going to need it anymore, and we can then back off of it. So no, I would absolutely say we're not married to these things. I think we got to evolve. I think we got to stay cutting edge. If there's something better out there, we got to do it to the best of our ability. Obviously, we can't do everything for everyone, but I think it's really important to just stay on top of the game. And if more information, better education comes out, we can cut through all of the pseudoscience and the fake news. You've got to listen to our experts, and they're going to help set us up for success.
Great. Well, I really appreciate this. I do have one last question that I think adds kind of another layer to this, different than where we've been. So if folks can hang with us, I know a couple guys have started mentioning they need to leave soon. I do appreciate the feedback. We've gotten good feedback on this, Greg, and what you've done live. We've also gotten good feedback about the favor manual and those resources. So I appreciate that, and certainly ask folks to keep us apprised of your feedback and of your needs. Just looking at what else popped up there. From Frater Nelson back at 7:15, so basically right when the Q&A opened, I think. He's asking, what real-time feedback and examples do we have from fraternities? I would expand that to other groups, workplaces, what have you. What best practices, what best known methods, what lessons learned do we have from groups that were still operating on campus or in a house late in the spring semester, from guys that have perhaps been still on campus doing anything in the summer? You know, what real street level lessons learned do we have? Do we have some examples we can share? And if folks on here as participants have any of your own examples, I would ask you to drop something into the chat, let us know, because that's how we can capture some of those stories and help share those along as well.
Yeah.
But Greg, do you have some example? I think of Kai from spring semester. I don't know where else you may be going. I know you've got some other stuff beyond what I'm aware of.
Yeah, absolutely. And you brought up Kai, and that's right where my mind went. We had a situation up at UW, the Huskies up there. One of my favorite chapters to work with. They called me up one day and basically, hey, we're going to have a brotherhood that goes and gets us tested. I'm like, oh, okay. And the reason I bring that up is that the students are hyper aware. They know what's going on. They understand what levels and things are at. And they were already working on a self-isolation piece if they were around the individual who had tested positive. They already had worked around putting him in a section of the house. And now, yes, Kai's house is gigantic. It's a 100-man chapter, right? So not everyone is blessed with the level of space that they had. And they were also transitioning out of a quarter and some things. So it's a different story, but the best practice here is really they took the local guidance seriously. They took the right steps to educate themselves. They abided by all of the local policies. They communicated. They were asking intelligent questions about how we should do this, and they let people know what was going on. They let parents know. They let us know. They let the school know, and it didn't blow up into this huge, oh my God, a fraternity house has COVID. What else have we seen in Mississippi? Fraternities are giving everyone COVID. And same school, Washington, fraternities are giving everyone COVID. Anywhere they can, there was Delta Sigma Phi was one of their chapter houses was on an article just today. Everyone's getting COVID, but there's no evidence. There's no evidence that those students in Mississippi gave anyone COVID. There's no evidence that Delta Sigma Phi chapter that was listed or anyone listed in the article gave anybody COVID. So I think you've got to be really careful about the PR. That's one of the things that I've learned through this is managing the PR, the privacy of those individuals, privacy of your chapter, understanding what that means for that student and that individual. If they have, diabetes, for example, that puts them at a higher risk. We've seen youth have life-altering, even death. So you've got to be, aware of what those students are going through, and they're going to take risks, right? They're 18 to 24 years old. This lobe right here isn't fully developed yet, but they also aren't stupid. They're not dumb. So if you put some protocols in place and properly educate and incentivize to get things done through your chapter facilities, your chapter events, that they're going to get to do more things. And when they get to do more things, they're going to continue to do more. So a lot of the best practices that have come up are in that guide, are really simple. The proper way to clean. I can't stress that enough. You've got to clean the proper way because you'll never get it disinfected if you didn't actually clean it. Getting the right kind of equipment for your guys that they're actually going to use. You can buy safety goggles, but if they're never taken out of the plastic wrap that they come in, your guys aren't going to use them, then you got to educate on why it's important and why they've got to have around the eye, that kind of thing. So to me, those are a lot of the best practices kinds of things. The comings and goings from the chapter rooms, so the individual rooms, limiting that to how many people can really be in there. So your visitor policy, I'd take a look at that and make sure that it's clear of how many people that they can have over and what they can bring into their small little room and what that means. I don't think anybody has cold air dorms anymore, so we're not going to necessarily worry about that. But understanding the comings and the goings, I can't stress the mental health enough. uh, Zoom fatigue, just the pressure of moving from an online class or an in-person class to an online class, and the ability to be effective students. That's a huge piece. So time management is a huge issue. We've already got poor sleep habits. We've already got alcohol abuse. We've already got stimulant abuse. What are they doing what are their coping mechanisms, right? So focus on their coping mechanisms so that they can handle the stressors better. What kind of education can we do around that? So guys are helping guys out, and they're doing it at a peer-to-peer level. As we were asked earlier, that to me, I think is a huge thing when they do it on their own versus having to be mandated. So to me, all that stuff is big. Some of the protocols that are put in place for offices, shutting down the water fountain and the places where people congregate, that seems to kind of help. But I've heard our office isn't fully open yet. We are, just doing the virtual thing and coming to the office as need. You got to make sure that the practices are maintained, because I've heard, it's really good when people come back and then it slowly weans off. So to me, the best practices is to be constantly reminding, and as leaders, lead by example, show me the way kind of a thing, and it's going to work. So that to me just comes off the top of my head of things that are working. But yeah, we already have a lot of this stuff in place with the guest list for events, doing events virtually, whether it's St. Jude or recruitment, utilizing what you have as resources. Yeah. And if anyone else has other good top practices, best practices, please feel free to share them out. And as we get more, we'll share more.
Yeah, and we'll certainly be encouraging folks to make use of the Facebook groups for sharing ideas and examples. That's a great forum that has a way of kind of growing, ebbing and flowing, right? It comes up at times and is a great tool, and then it kind of goes dark and quiet and isn't as vibrant. But I think it's a great opportunity for more of that sharing across Teak Nation, in addition to what we're pushing out. And in that mode, to just wrap this up now, in terms of what else we are sharing, the COVID or the favor manual is going out to students on Wednesday. Is that right?
I believe that was the plan.
That's the timing plan. So we wanted to do this forum. We wanted to get it out to you, the volunteers, early, do this forum with you in anticipation of the favor training that we're a part of this week, as Greg mentioned already, but also we wanted to be ahead of the distribution out to the student leadership. So as this goes out to the collegiate members, that's another piece. I know Greg was also talking about transparency and the sharing with the campuses. I think is a great opportunity. I would share, as the parent of a student who just finished his first year of college, I know I'm getting communication from the institution. I think it would be a great, and it certainly isn't at the level I've seen in this favor manual. So I would encourage the students to be sharing this with their parents, or you from the board sharing this manual with your parents if you have that contact list. But that's great information to be sharing and helping put them at ease, help build up that coalition of support for them to know that we're being as responsive and responsible as we can about this as well. So sharing that resource is valuable.
Chris, on that note, I know you mentioned about getting notes as parents. You got to read what's getting sent out too. When you said that, I just quickly triggered, and I see Alex Baker's in the chat here a little bit. I'm sure Alex and I had a very deep discussion about the school where our children are going to be going. They tweaked a little bit of language between the first guidance that the school sent out and now about mask wearing. So anytime the school is going to send something out, please read it, because that one little thing changed the game. And it went from masks being required just in the hallways and the common spaces to masks being required in the classroom. And when you've got young children like Alex and I do, that is a huge game changer for how to parent and give guidance. So you got to remember, our guys aren't going to read everything that's emailed to them, because they don't read everything that's emailed to them regardless. So I appreciate anything that volunteers can do to help, keep guys safe and, put guys in a position to be successful.
Yeah. And with that, the last question here in the queue is, Greg, can we expect that there will be additional forums like this? This is our first, and right at the front end, having received the manuals, do we expect there's going to be additional opportunities for the information and for the dialogue?
Yeah, I think that's demand driven. And we're at a point right now where we've got this many people showing up on a Monday night, wanting to talk teak and put our guys in a position for success. I think we would be silly and naive to not try this venue again. And what topics you guys have for us. I know I'm more hesitant to talk about policy and procedure, legal type proceedings in this type of environment. I'd like to do that more in person and over a phone call. But if you've got other questions or topics for us to bring up in this virtual setting, I think absolutely we should. We're working on programming right now for all officers and some specific stuff for recruitment chairman and Preet and I. So if your chapter members, your collegiates haven't signed up for that in the next week or so, when we start announcing it, you're going to want to follow up with on that in the next week or two. So as we get that stuff out, and I think as we get better information and more data on our housing corporations, absolutely. We can bring in other special guests. I can call in favors for people that I know and talk to. We can bring in other fraternities to talk about what they're doing. The opportunities are endless when we utilize these mediums. So I look forward to doing it again. This is fun. This is energetic. I actually like talking about policy and procedure, unlike many people. So thank you for a great night, you guys.
There you have it. And there's another thank you that John Gorski just dropped into the Q&A, and that closes our queue.
All right.
I'll leave it to you, Greg, if there's anything else.
Just a huge thanks. I know this isn't easy. I know this isn't what you necessarily signed up for. I know that this, what kind of hand sanitizer do I get? What kind of spray bottle do I get? I know this isn't easy stuff, and I can't tell you how much I appreciate it and how much the students are going to appreciate it when you give them their fraternity experience back in some form or fashion. They're just going to be chomping at the bit to do great things. And that's because of the fantastic alumni that we have. So from the bottom of my heart, thank you guys for being here. Thank you for investing in our guys. It pays off, and look forward to seeing you guys in person when we can. But until then, we'll stay here virtually. On that note, y'all have a great night, and stay healthy.